Alright guys, thought I'd start off with a quiz. So here's a question up here. See if you can answer it. Hint, the answer is on the last video. So if you haven't seen that, go and watch that first and then come back to this. Pop the link just up here. Welcome back to GP Made Easy. I'm Dr. Daniel Follows and welcome back to our series on palliative care. So today we're going to be covering how to manage common symptoms that patients experience in palliative care. But before we do, don't forget to like, comment and subscribe so I know that you're enjoying this content. Anyway, on with the video. So the symptoms we're going to be covering today is breathlessness, pain, nausea and agitation. If there are any other symptoms you'd like me to cover in future, then please comment down below and I'll pick them up in future videos. So first on to breathlessness. So this can be a common symptom in advanced cancer, COPD, pulmonary fibrosis and heart failure. It can be a combination of physiological, psychological, spiritual and social causes. So first of all, before just managing the breathlessness, it's worth first identifying the cause and checking their current medications that they're on for the condition to see if they need maximising. If they are maximised or there isn't anything else you can do, then you move on to just treating the breathlessness itself. So some non-pharmacological measures that you can try include certain breathing techniques such as pursed lip breathing. You could try opening a window. You could try giving them a handheld fan that they can hold in front of them. Or you can try changing their positioning, for example, sitting them more upright. And then if they aren't helping or the patient doesn't want to try them, then we move on to pharmacological measures. And the main thing for this is using opioids. So you would normally start them with some liquid morphine that they just take every now and again when they're feeling breathless. Or if they're needing to use this quite often, then you could try using a modified release version of morphine so they get that constant 24-hour relief. Now if the main thing is that they're having a lot of secretions and their chest sounds crackly, then what you could try instead is hyacinth butyl bromide. And there are many different forms. You could give them tablets, or if they're struggling to take tablets, you could try a patch, or as we discussed in the last video, you could try using a syringe driver. So next we move on to pain. Now the type of pain and management of that pain can vary depending on the cause. So for patients who are having just generalized pain or pain that's coming from an organ, the way that we manage this is with the stepwise ladder. I'll put it up here. So essentially, first line, you start off with paracetamol with or without anti-inflammatory medications like ibuprofen or naproxen. If that doesn't work, then you would think about adding on weak opioids such as codeine or tramadol. And then the third line, if they're still in pain, would be looking at morphine-based medications. So with morphine, the type of morphine you give, such as normal morphine or oxycodone or even fentanyl, depends on the patient's kidney function. So please always check that before prescribing and check the national formulary as well. Also, there is guidance for when swapping from one type of morphine to another, as there are different concentrations, as can show you up on the table here. But there is also guidance when swapping from, say, like morphine to a buprenorphine patch or to a fentanyl patch, and I'll put those little tables up here as well. So moving on to if someone presents with a spasm type pain, this is where it will suddenly get worse and worse and worse and worse. Feels like someone's just tightening, and then after a bit it just releases. So the commonest medicine we tend to use to treat this is again hyacinth butyl bromide, so you can always give that a go. And then moving on to neuropathic type pain or nerve pain. This is where someone's presenting with like a burning pain or like pins and needles or tingling. And the commonest thing we use to tend to try and treat this are the neuropathic type medicines. And the commonest ones we have are amitriptyline, gabapentin, pregabalin, and duloxetine. So next we move on to nausea. So this can be a very unpleasant symptom and management of it can be quite complex. The guidance recommends if a patient has any of these conditions to seek palliative care advice first, and these include Parkinson's disease, myasthenia gravis, porphyria, a pheochromocytoma, a history of neuroleptic malignant syndrome, and this is an adverse reaction to antipsychotics, if they have a history of serotonin syndrome, or if they have a history of tardive dyskinesia. So first thing to do is to identify the cause of their nausea, if it's reflux or cancer related, or if there is another cause. And then next is to consider whether you may even need to get blood tests to check things like their kidney function, their calcium, their blood sugars, and I'll put all the blood test investigations to consider up here. And then next we move on to medical management, and this all depends on the cause. So first of all, if their nausea is caused by biochemical changes or if it's caused by a medication, then what you can give include haloperidol, levomepromazine, or olanzapine. If their nausea is associated with dizziness, vertigo, or altered consciousness, then things to consider are prochlorperazine or cyclizine, levomepromazine, or olanzapine. One thing to note, if their nausea is associated with a brain lesion that's causing a lot of edema, then something you could do is have a chat with the specialists if they may need something like steroids like dexamethasone. And if their nausea is caused by movement or travel, then you could try prochlorperazine or cyclizine or levomepromazine. And finally, we move on to agitation. So this mainly occurs at the terminal phase of an illness, but first things to do is to identify any cause for the agitation, such as pain, constipation, or nausea, and treat that first. And next is to look for anything in the environment that you can change to calm them down, such as introducing some music or repositioning them. If all of these don't work, then the next step would be looking at medication to try and help. So the first line we tend to use is benzodiazepines, such as midazolam or lorazepam, or you could try something like haloperidol. Well, that's it for today's video. I hope you've enjoyed it and found it useful. I'll link all the resources in the description below. For example, the NICE guidance, the SIGN guidance, and Marie Curie guidance as well. Don't forget to like, comment and subscribe so I know that you're enjoying this content. And if there are any other symptoms you'd like me to cover or any other topics you'd like me to cover in future, then please comment down below. I also post more regular shorter videos on YouTube Shorts or Instagram or TikTok, and it's up here. It's just the same name, it's GP Made Easy. Another way you can get in touch with me is via email, and I'll just pop my email up here. Well, I hope you guys have an amazing week, and I will see you in the next video. So on to Bible scripture of the week. So for this week's one, I picked James chapter 2, verse 26. And it says, "For just as the human body without the spirit is dead, so faith without works of obedience is also dead." So have a think about that and think, while you're waiting for things, what you could be doing in the meantime. Well, I hope you guys enjoyed it. Don't forget to look at any other videos just up here. And especially don't forget to hit that subscribe button. Well, I'll see you guys in the next video.